This week I'm going to talk about organizational change in my field placement. As you know, I am at Frisbee Memorial Hospital. That's located in Rochester, New Hampshire. So within that hospital, there is what they call the care management department, and in this department they have care managers that work with the patients that are on the floor. Currently in the hospital there are only 2 social workers. One is licensed. She's actually my on-site field supervisor, and that's Sue Deming. And the other social worker that I work with is Mark Mason, who has a master's in health and human services and is considered a social worker but does not actually have a degree in social work. He has a degree in counseling as well as working within the human services field. I did have a little bit of a difficult time trying to get into my placement because they were doing so many changes within the department. So the hospital is actually getting on board with all the other hospitals in the area in regards to exactly what health is, and they're using the World Health Organization's definition, which is incorporating the whole being, not just the medical aspect of it. So currently, right now, I believe there are 6 case managers that work there, and the majority of those case managers are RNs. So they can pick up on the medical standpoint, but have a little bit of a difficult time on the social service aspect because they're not used to dealing with that. And within the next, I believe, 6 months, the head of the department had an organization come in to evaluate the care management department and to see what changes needed to be made. They have now incorporated a social worker that will be working in the emergency room, trying to decrease admissions that have been coming in, because some of these people that come into the emergency room are not, need to be seen on a medical basis, but could technically speak to a social worker and have someone address the needs that they have at the time. We have a lot of patients that are reoccurring admissions into the emergency room, sometimes up to 30 times within a 2-month time period. So they're trying to establish as to why that patient keeps coming back and seeing if maybe by having a social worker in that department, they can get those needs addressed and decrease the amount of readmissions that they do have. They are also creating a utilization review department, and right now there are 2 people that work in the utilization review department, which is not enough because that UR department is extremely busy due to the amount of patients that we have in dealing with insurance companies. The hospital is also incorporating, they have a program that is called Milliman, which is a medical criteria program that basically what it does is it justifies a patient's patient stay in the hospital as to whether or not they meet these criteria. So at the end of the day, the case managers and social workers will go in and look at the medical criteria for the diagnoses that are given to justify to the insurance companies as to why they are there. That is being taken away from the social workers and actually being given to the RN case managers to do, because the social workers, their primary role is going to be dealing with setting up long-term care services for patients such as psychiatric patients that need outpatient counseling and what have you, as like also having referrals out into the community for any physical therapy, speech therapy, rehab patients, anything like that. As well as providing some counseling within the hospital, which is something that they did not have before. And also there are quite a few physicians' practices that are attached to the hospital that are now hiring clinical social workers to work for them. So the patients that are in an outpatient setting, if they are having any type of financial issue, or just basically any issue that they need counseling for, the social workers there can utilize their skills with strengths perspective, evidence-based practice, that type of thing, and hopefully that will decrease the amount of emergency room visits and whatnot. There's quite a bit going on. I've seen quite a few interesting things that I don't see from a nursing perspective, so it's been a little bit of an eye-opener for me as to actually what goes on behind the scenes at the hospital and what each particular person's role is. Right now it's kind of a little up in the air because they're trying to get these social workers in and to start establishing exactly what their role is going to be and how they're going to advocate for the patient in the best way and utilize their services. So there's a lot of changes going on right now, which is, it's really great for me to be there and to see it at this particular point, because I really wasn't sure exactly what was going to be happening as far as a social worker's standpoint goes, working within the hospital. So I'll keep you posted on how that goes. It's pretty exciting. I see that I'm going over my time, so I hope that you all have a great week, and I'll talk to you soon.